Hi everyone, welcome back to my channel. So today I have a bit of a probably messy video. I'm going to try to do a commentary on another video. As you guys know, I don't edit my videos, so it's not like I'm going to have it like inset in this video. I'm just going to play clips from this other video and then add my commentary to it. So there's this radio host. I think he's in Arizona. His name is like JohnJay. Has a show called like the JohnJay and Rich Show or podcast or whatever. So he recently did stem cells at a clinic in Mexico. And I don't know, I have a feeling that it was some kind of an agreement between him and this clinic. And so he's basically giving free press. I don't know if he got the product, the procedure done for free or what, but to me it seems like there's kind of this relationship where he went to this clinic in Mexico, and now he has the scientific director of the clinic on this podcast. So this is a panel of there's 6 people: JohnJay, which is one guy, his co-host Rich, and then a doctor, some other lady, and then this old man that was a patient at this clinic, and then the scientific director. So I watched this whole thing. It's about a half hour long, 40 minutes, and there were a lot of things in it that I felt were misleading or misconceptions about stem cells. And you're going to see that even in this video, the scientific advisor or the guy from the clinic, he kind of does step in later on and starts kind of saying things like to try to not correct, but I don't think he wants to upsell the, stem cells. But at the same time, he kind of, it's a really interesting panel. So it's called JohnJay and Rich, Health and Wellness, a discussion of new alternatives for feeling better. So here's this guy, this older man.
I can't pronounce any of the words, but I just say
his name is,
and he sends me to Panama.
I forget what his name is. He's like 100 years old.
Raphael and what he was doing at the time. Went to Panama. My ejection fraction was 20, the amount of blood that pumps up to your aorta. At 18, 17, and maybe 20, you're dead. Ejection fraction of 20. Didn't like it very much. Go to Cancun. Goes from 20 to your aorta. At 18, 17, and maybe 20, you're to do with me. Am I just a freak? So I go along and everything's fine, and then I get into some more trouble. I have some other heart problems that come probably as a result of the vaccination, which Annette and I signed up for to get right away, and then we had the booster.
Okay, so that's the first thing, is that this guy, he's got to be like in his 70s or 80s. I mean, he looks pretty bad. He has a lot of heart problems, right? He had pre-existing heart problems. You'll also find out later in this interview, he's had cancer. He's had all sorts of things. Right away, he's blaming the vaccine for his heart issues. That's not what caused his heart issues. He had pre-existing heart problems. Now he's saying that the vaccine is making things worse. Always watch out for stuff like that, especially if, and I'm not saying that the vaccine doesn't cause heart issues. We do know that it can cause some heart issues in some people. But this guy already had pre-existing stuff. So, he does go on to say that and that's another thing that you guys have to pay attention to with this interview, is that this guy, by the end of this video, he's had stem cells like 5 times in order to get that ejection fraction number down, which I don't know anything about, heart issues, but, that's his issue, and he's trying to resolve the heart problem with stem cells. Okay, so then fast forward to, I'm trying to get to the exact part here.
Stem cells. It's an unbelievable experience. There's no pain. I've investigated very, very deeply the side effects. If you get contaminated cells in the United States with some maverick, it can kill you. It needs to be regulated. what I saw in Cancun and what I saw in Panama, for that matter, was really, really unbelievable science, cleanliness.
Okay, so there's no side effects. He says that he's talked to like different people. They can't tell him any that has any side effects. Stem cells absolutely have a lot of side effects. Even if the treatment doesn't go badly, they do have side effects like fatigue, nausea, vomiting, headache, things like that. They do have plenty of side effects. If things don't go well, and again, even if you don't have contaminated product, if things don't go well, you can have like what I had, right? A bad reaction, worsening of your symptoms, worsening of your neurological symptoms. It really depends on your illness and what is going on with you. This guy just had the heart issue, basically like heart damage, wear and tear, and some inflammation. He doesn't have an autoimmune illness. He doesn't have, a lot of those kind of complex processes going on in his body. So that is just such a huge misconception that stem cells do not have side effects. Stem cells, exosomes, any of those things, they all have side effects. And like I said, treatment can go badly even if the product is not contaminated, even if the product is great and perfect, things can still go wrong. And it does depend a lot on what your issues are. So now let's go to, I have everything written here.
Are, but it's cheaper and there's no side effects. And the recovery time is about an hour. Just getting rid of the needle in your arm and staying kind of still, which they ask you to stay.
Okay, once again, we just talked about the side effects. Now he says the recovery time is about an hour. No, it isn't. Like I said, if things don't go well, I drove myself to the clinic. I got exosomes. Exosomes and stem cells are essentially the same thing. But I have seen, depending on what procedure you're getting, there are people that do get stem cells and exosomes directly injected into joints. There was actually another guy, because I look at the Instagram account of this stem cell clinic, this one that he's talking about. I follow it very closely. There was another guy, like an athletic, yoked out, like strong looking guy. He got injections into his joints. I think they do like joint injections, but also infusions. And I think he got both. And that guy said he was in so much pain, he needed serious painkillers to help the pain. And that's kind of contraindicated, I think, with stem cells. But regardless, it is not a 1 hour downtime. You can be sore for a while. And then, of course, depending on what response you have, yeah, you might be able to function and that kind of thing. But, again, what is your response going to be to this therapy? Somebody can have a lot of pain immediately after. It's not going to be 1 hour of downtime. It may take a few days for the soreness to go down or for you to feel not better from your issues, but just for that initial soreness to go down. Again, if you have a bad response to it, nausea, vomiting, things like that, or just for me, it's been well over a year. And I still don't feel like I did prior to the treatment. So when he speaks of there's no downtime, I really don't want people, I don't know if he means like, you'd have to stay in bed for a while. I mean, yeah, I could walk around and do stuff, but really, I mean, it's just such a huge misconception. And like I said, it's not just me. I've seen this with other people that have pain or that have other issues or that flare up sometimes for a long time. I've seen other people in the Facebook group that I'm a part of that are still dealing with their flare up several months out. Like I said, I'm 15 months out and I'm still dealing with this flaring. So it really depends on what you consider downtime. So again, he just keeps going on and on. This guy keeps going on and on about how there's no side effects, how there's not like a single scientist in the world that can tell him what the side effects are. And he's a lawyer. He's not, he's a patient of this clinic. He's a lawyer. He has nothing to do with stem cells, doesn't know what he's talking about. So I just want to make that very clear. I really wish the people, and I feel like when I was looking at the comments of this video, I don't think a lot of the people were really buying into what was being said. So that's good. Some people out there are pretty smart. Okay.
Prepared for them, not going to be as good as if you're read things that Dr. Bordenko do. Because stem cells on their own, unless you're relatively healthy or if you're prepared for them, not going to be as good as if you're ready for them and if you've taken the appropriate steps with someone that knows to take the appropriate.
Okay, so now the scientist, the scientific advisor is stepping in, and he starts to to come in and sort of like say, well, it's not as good. Stem cells by themselves can't do anything. I think that was his next comment, is that on their own, they can't just go in and fix stuff. You have to be taking care of your body, diet, exercise, all of that. It's not just going to be like, here are the stem cells and you're good. So he was pretty quiet for most of this. This is already like halfway through the whole video. And then he starts to talk, and he's talking like very carefully, like, by themselves, they're not going to be able to do, everything. And I think he also mentions that this gentleman, I think the lawyer's name is Leo. The scientist, or the scientific advisor guy, he does step in and he says he's had this done several times. He's had multiple applications of stem cells. So it's not just something that you do once, especially if you are in that bad shape as this dude. He goes, he's had it multiple times. Because remember, he started in Panama. He started getting stem cells in Panama and then moved to this clinic in Mexico. So it's something that that you got to pay attention to. So he goes on to say, and he makes a pretty bold statement here in this clip.
You're not getting a white blood cell. You're not getting all the different endothelial, all these different. These are pure stem cells. And what you're getting is anywhere from 100, depending on the individual, anywhere from 100 to 200. And going to Leo's, trying to
positive vibes,
but
right?
that's a positive, yeah. But it's doable. It's something that's doable, something that's achievable, as long as your mindset to it, and as long as you have everything around it, the support of around it of all the different things. If anybody tells you that a stem cell is going to heal, it's going to cure you, I'm going to tell you no. Leo just gave you an instance of how many times have you done this? 3-4 times already?
Done it 4 times.
Yeah, 4 times already.
Okay, so that's where he says stem cells are not going to cure you. This guy has already done them 4 times just to get this heart issue under control, right? So obviously not going to reverse everything. On top of the fact that that's not his only problem. This guy has had heart issues, cancer, hip problems. The stem cells actually could not do anything for his hip and joint issues because you have to have cartilage in order for the stem cells to regenerate whatever's going on there. So they didn't work for his joint problems at all. And, I also thought that stem cells were contraindicated in people that had cancer or have had cancer, but I don't know. The guy actually had I think active cancer cells, and they still did them. So this is a scientist or researcher who oversees this clinic, and he's telling you they're not going to cure you. They're not going to, if you're expecting stem cells to fix what you've got, it's not going to do that unless you provide an environment for them, a good environment for them to be able to do that. There was another comment here. Let's move up.
16 year. I don't remember how many push-ups. Now, hyperbaric oxygen chambers a lot because you got to have that increase in vasculature, that increase in blood flow. That stem cells are for everything? No, they're individualized, understanding of gathering what it works for, what it doesn't work for, but it works for many things.
What does it crush at? Like what if you have an ailment, what are the ones like back pain? Does it help with, people have back pain or cancer? Like, is it more effective for one type of ailment?
Yeah, I would, in the context of anything autoimmune disease, phenomenal. And I'm talking about the context of the cells that we actually use. We cannot use those cells here. They're in FDA clinical studies. In Mexico, we're approved to actually use them. We can use them because these are culture expanded in the clinic.
Okay, so he flat out says, are they good for everything? No, they're not good for everything. And that's, I think, again, one of the biggest misconceptions of stem cells is that they can fix everything, right? We also saw the same thing with medical marijuana. Oh, that can help with everything. It can help with Lyme disease. It can help with seizures. It can help with cancer. It can help with everything. It doesn't. And it depends on the person and it depends on your illness. And this is coming from a scientist. But it works for many things, yet he doesn't go specifically into all of the things that it can help with. And to be honest, I disagree with that statement. Is it more effective for one type of disease? When he says autoimmune disease, this is where it kind of trips me up a little bit, because just to say that stem cells help with autoimmune disease, that they're great, because I think he says something like that, like they're great for autoimmune disease. I will tell you myself, they are not. If you guys have seen my review of the Selma Blair documentary, she does do stem cells, but she does something called HSCT, where they hit you with chemo to destroy your immune system, and then they infuse your own stem cells into your body. And by the way, these stem cells that they use at this clinic are not your own stem cells. They're donor cells. So when he says they're good for autoimmune disease, I would like to see, well, which autoimmune diseases do stem cells, donor stem cells by themselves actually help? Because as far as I know, that's not how it works, right? We know that HSCT works for some autoimmune diseases. Multiple sclerosis, stiff person syndrome has been shown to be helpful with the chemotherapy. But, this whole thing of it helps with autoimmune disease, I'm not sure where he's pulling that from, because, we would be seeing this, we would be seeing a lot of people going to Mexico getting this done. People with lupus, people with MS, people with, I don't know, autoimmune diseases. I don't see that, I don't see that happening. And I don't see, we would have heard about this by now. And it doesn't seem that they are helpful for really much. I know that they are helpful for joint problems, arthritis, things like that, when they're injected directly into joints. And again, like I said before, you have to have some amount of cartilage in order for it to regenerate that. So here, this one I think is the most important statement that he makes.
Depending on the individual, if somebody goes in that's really unhealthy, immune system's on overdrive, chronic inflammatory disorders, you put a cell in there and the cell's used to this phenomenal, perfectly balanced food. I'm now putting it into a harsh area. Your immune system's going to recognize this and say, the hell's this doing in here? Start wiping it out. Those are individuals that you commonly see or have some kind of a cough or cold that will have a lot of body aches, flu-like symptoms. That's a side effect of it. It doesn't necessarily mean that the cells are not working, because the cells are still secreting out.
So I want you to pay attention to what he just said there, that you put him into an unhealthy person with an immune system in overdrive, which would be someone like me, and probably most of those of us who are dealing with chronic health problems, long COVID, stuff like that. Your downtime is going to be different than this old man that has a heart problem. The scientist just said it. So he's basically debunking everything that this old guy just said. And he's saying, you put this into an unhospitable environment, you're going to have flu-like symptoms. Remember, I had several flu-like episodes. And I do think he doesn't elaborate. He does say that, but you also have to keep in mind that I think the worse your system is, and I've been sick for almost 20 years, disabled for 10, the worse you are, I think the harsher that backlash is going to be, to the point where it may kind of mess you up. I think that's probably what happened in my case. He's not going to say that. He's obviously saying, oh, the stem cells are still working, right? They're still going to work, but your body is basically just so bad. And that's basically what I was told, is like, oh no, you have other issues. You have gut issues. You have all these other problems. That's why it didn't work. So I feel like that's kind of almost what he wants to say. It's not that they're not working. You just feel horrible because your body is in such bad shape, which again, to me is kind of a load of BS. Just say that they don't work and that's it. Just say that the person is too sick and is probably not a good candidate for the treatment. What he said earlier, you have to put them into an environment that is already doing well. or that has other components that are doing well, which again, a person with autoimmune illness, long COVID, high levels of inflammation, the reason you're doing stem cells is because you can't do well with everything else. You've done everything else. I've done diet, I've done the exercise, I've done, supplements and all of that, and I'm still, struggling. So, I really, really, I take issue with, I mean, he is kind of clarifying it. He's clarifying things without clarifying things, because obviously they're trying to drive business to this stem cell clinic. And, that's his job. He has to bring business in. So now we come to, this is the last piece, because this video is pretty long.
And use it and he's going to put it together and put it on a petri dish or whatever they do to make this for you. You got great blood, but it's not going to work if you haven't done this right. So I do it again.
Oh, hold on.
It's a
Seeds of Botox in my face.
method of keeping the immune system in a regulatory state.
Does it also help with skin? Because I don't know if you guys can tell, but I'm like very close to all these people. And like I'm looking at you, Leo, looking at your skin, Dr. Carey, I'm looking at your skin, Raphael, I'm looking at your skin. You got like amazing skin. Like no wrinkles. And I'm like, I got like a bajillion cc's of Botox in my face. And I feel like, like more wrinkles than that. I'm like, does it help with that
Botox.
too? Because I mean,
stem
Leo's talking
cells.
about side effects. And I'm like, maybe the stem cells, maybe that's a side effect of the stem cells. But is it the NK cells or like?
It's the stem cells. A lot of people report after having it done more like you have some flushing, increased blood flow. You got to increase blood flow to the skin, to all the, it's the biggest organ in the body, the skin. And you have to increase blood flow to it, and you have to maintain that inflammatory.
Okay, so for time purposes, I'm just going to summarize the rest of it. So, yes, stem cells and exosomes can help your skin. That is one thing that I did notice. The only thing that I've noticed that's been really consistent is my skin is clear. I've had patches of acne that have cleared up really well. My pores are smaller. Have I noticed any wrinkles going away? No. It would have to be applied topically to the skin in order to get that increased like collagen, or if you're trying to treat acne scars and stuff like that. She also goes on to say, it's like Botox, right? Oh no, there was another lady. Her name was Carrie, I think, and she's an actual MD. She goes, yeah, a lot of people report that they don't have to go back and do Botox after they do stem cells. That is such a complete lie, total lie. They do not work like Botox. They are not going to paralyze your muscles or smooth out your wrinkles, at least not an IV infusion. If they're applied topically, I think that's when they do help some of the collagen. They have to be like injected into the skin, or I think you can do like microneedling, stuff like that. Can also help with acne scarring. I don't know to what extent it actually does help that, but for the purposes of this video where they're talking about IV infusion, and I think they also talk maybe about joint injections, it's not going to do that to your skin. My wrinkles are not going to go away. The sagging is not going to go away. To be honest, I don't think it's going to help you with sagging skin very much. You would need a facelift for that. So it does not work like Botox. It's not going to be able to replace your Botox regimen if you're getting Botox. It may clear your skin, maybe make your skin tone a little bit more even. Maybe if you have an intravenous infusion, I do notice that I still have some patches of discoloration. That kind of stuff you'd have to do maybe like a microdermabrasion or something else to get that discoloration off. But I'm going to tell you right now, it's not going to take the wrinkles off of your skin. Like that was the one that I was like, that's just such a complete false thing. And I know the doctor chimes in. She chimes in and she says that at the end.
So you don't get all those wrinkles. You don't lose that propensity of fat plumping, all of that.
But you do get collagen stimulation. I mean,
Yep.
that is something we see overall because a lot of people who are in the age bracket that are going to go after this therapy, right? They've probably already started their Botox and filler regimen.
See, it does stimulate collagen if you do it topically or if you inject it. So don't, I don't like that they're making it seem like you can go get an infusion and that's going to plump you up. It's not going to do that. So anyways, thank you so much. I knew this video was going to be kind of long and kind of messy. I just tried to have the clips organized. But if you have any other questions below, let me know. I'll try my best to answer them. Remember, I am not a doctor, but I have received this product or similar products intravenously. And, I think my experience is helpful for people that are considering this, for an illness, autoimmune illness, chronic illness, high levels of inflammation. What we're missing in a lot of these types of videos and in these types of informational things is the patient experience. And there was a patient there talking about his experience, but he also had one very specific thing, and I don't know, he just seemed like a very unreliable, what do you call it? Reviewer, so thank you so much for joining me. Please like and subscribe, and I will see you in the next one. Take care.